According to the CDC, during late June of 2020, 40% of US adults reported struggling with mental health or substance abuse. This incredibly high number highlights a major problem faced in the last century, a high increase in mental health issues. With such, new treatments and interventions have been researched in order to address these challenges, such as the use of psychedelics for mental health issues. Good evening, I'm Miguel Hirai, and this is the effects of psychedelics in mental health treatments. Today, I'll be answering the research question: has research on the implementation of psychedelics in mental disorder treatments been proven to be effective in the 21st century? After further research, I have concluded that the implementation of psychedelics has been proven to be effective. As we have seen, mental health disorders have been on the rise, affecting a significant proportion of adults in the US. Traditional treatments for these conditions often include medications that can have unwanted side effects and may not be effective for everyone. However, scientists have been exploring alternative treatments using psychedelics, which have shown significant potential benefits compared to traditional treatments and can be cheaper in some cases. As Maya notes, there has been a reassurance of research interest in psychedelics in the past decade, after a long ban on such research. Researchers have recently started to investigate the use of drugs such as LSD and psilocybin to treat psychiatric disorders such as depression, anxiety, and PTSD. Studies have shown that substances like psilocybin have been positive in treating mental disorders such as obsessive compulsive disorder, end-of-life psychological distress, alcohol and tobacco addiction, and major depression disorder. The prescribed usage of such chemical when treating patients with mental health problems can be a light at the end of the tunnel for the large number of disorders that have been present in recent years. Thanks to recent discoveries, producing psilocybin has made it a lot cheaper. Alexandra Adams and her colleagues have found a cheaper way to produce psilocybin using modified microbes, which can produce up to 1.16 grams of psilocybin per liter of culture medium, the highest yield to date from any engineered organism, and a 10-fold increase over the next best attempt. The new method could produce psilocybin for potential therapeutic use. In addition to psilocybin, other substances such as MDMA have shown significant result when treating certain conditions like PTSD. MDMA can be used in PTSD treatment because of shown in the graph, MDMA was equally effective in participants with commodities that have been often associated with treatment resistance. Participants with the dissociative subtype of PTSD who have received MDMA-assisted therapy had significant symptom reduction. MDMA has also been proven to enhance fear memory extinction. Late fear memory reconciliation and bolster social behavior in animal models. Ketamine has also emerged as a promising tool in the field of addiction treatment. Recent studies have shown that ketamine-assisted psychotherapy can effectively promote abstinence in individuals struggling with heroin and alcohol addictions. In one study by the chief of the Department of Addictions, Avery Krupski, 26 participants received either ketamine-assisted psychotherapy or traditional psychotherapy. 13 out of the 26 participants who received ketamine remained abstinent, compared to only 6 out of the 26 who did not receive ketamine. While more research is needed to fully understand the potential benefits and risks of using ketamine in addiction treatment, early research results are promising. It's important to note that ketamine should only be administered by trained professionals in controlled settings and as a part of a comprehensive treatment plan. While the use of alternative treatments for mental disorders show significant potential, it is essential to consider some limitations. For instance, psychedelics are not legal in many parts of the world, which restrict their availability for research and treatment. Additionally, the use of these substances require a controlled environment and trained professionals, which can be costly and challenging to access for some patients. Lastly, the long-term effects of these treatments are not well known, and there is a risk of advertised effects of side effects that could have harmed patients. To address some of these limitations, efforts can be made to increase awareness and change regulations around the use of these substances for treatment. Governments can create more pathways for research and clinical trials to expand the availability of these treatments. Additionally, there can be more investment in training professionals to administer these treatments. Long-term studies can also be conducted to better understand the potential risks and benefits of these treatments. By implementing these solutions, alternative treatments for mental disorders can become more widely available, accessible, and safer for patients. In conclusion, alternative treatments for mental disorders through the use of psychedelics have shown significant potential benefits compared to traditional treatments. With recent advances in research and cheaper production methods, these treatments could become more widely available and help a wider range of patients in the future. It is important to note that the use of these substances should only be done under the supervision of trained professionals in controlled environments to ensure their safe and effective use. This is my works cited page. Thank you.
All right, 2 questions for you. First up, how valid and reliable were the sources that you used, and how do you know they were?
They were very reliable because I got them from ADSCO, which is a very reliable place to look for sources, and there are also all papers that were reviewed by professionals.
All right.
Scientists.
And then, what advice would you have for other researchers who consider this topic in the future?
I would suggest that you look for sources that are not biased, because sometimes there can be sources that are a little bit more sided to the part of legalizing for everybody maybe the drugs, but some others say that you shouldn't even use them to treat those disorders.